आप स्टार्ट करोगे फिर मैं So you want to take this one? इधर आ जाइए और इसके अपना पता أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي السلام عليكم ورحمة الله وبركاته. Jazakallah khair everybody for taking the time out to attend our workshop today about fasting in Ramadan with diabetes and other chronic illnesses. So alhamdulillah, we have a panel of physicians with us today. And before I introduce them, I will just briefly introduce the format of the workshop. So inshallah, we will have our speakers speak for about an hour and a half straight. If anybody has any questions, whether on-site or online, we request that you make a note of them, and inshallah we have a moderator online who will be taking care of the questions. And near the end of the talk, our speakers inshallah will take any questions anybody has. So that's the format of the workshop, inshallah. And inshallah now I will introduce our first speaker, so Dr. Saima Khan. She is a family physician with a dual focus practice in intervention, pain medicine, and obesity medicine. She's also a graduate of the Schulich School of Medicine and Dentistry at Western University. She's been practicing in the community for the past 12 years. Her practice is at Mavis Medics near Square One area, where she provides consultations to people with chronic pain and obesity. She is adjunct faculty both at Western and at UFT and is actively involved in teaching medical clerks and family medicine residents. She has completed her diploma in Quran and Bukhari in 2018, and she has established Chatham Kent Weekend Islamic School, a nonprofit organization for Canadian Muslim youths to empower them against identity crisis. She is an active public speaker and presents health and wellness topics in light of the Quran and Sunnah. So inshallah, I would like to welcome her to start her talk.
Jazakumullah khair, Sister Asma and her team, for giving us this platform to talk about one of the most prevalent illnesses that is in Canada, and how we can better manage these chronic diseases, especially in the month of Ramadan. I would like to introduce my team and just to go over the project that we have taken this year. Myself and there are two other colleagues of mine, Dr. Shaikh and Dr. Ali, who has been working with me from past 3 months with these presentations. We have been doing a lot of these talks in past 3 months in different communities and mosques. Dr. Shaikh is a practicing family physician in Burlington and Milton. Dr. Ali is a practicing family physician in Oakville. The other team member of us, the lot of credit for nutrition goes to my dear colleague, Shaistha Zahiruddin, as well as Abir Anis is our researcher, and she was able to help us with compilation of the presentations. We have a team of volunteers and educators who have been helping us delivering this workshop. I would like to bring this special information to all of us. The concept of diabetes and Ramadan has been going on for many, many years. But this gentleman by the name of Dr. Muhammad Hasnan, he is a practicing Egyptian endocrinologist. He actually came up with this, that all the Muslim physician or the Muslim Ummah should be collaborating with the International Diabetes Federation, so that all the community as well as the physician should know how to manage diabetes in Ramadan, because it is a stigma. We don't know what medications to change, how to adjust insulin, what information we give. And because the Muslims are all over the place, some countries would have fast for 12 hours, other countries would do fast for 19 hours. So the things and circumstances changes. So he, alhamdulillah, came up with this. So he established something called as DAR, Diabetes and Ramadan Alliance. And this is the second guidelines. He chaired that. He was the first author of that. And he's also the author of the American Diabetes Association. And the second guideline came up at 2021. And also there are a lot of Muslim, alhamdulillah, Canadian endocrinologists. One of the endocrinologists is Dr. Abu Hassan. He was my mentor when I was practicing in Chatham, Ontario. So I just wanted to pay gratitude to both of the physicians. We are very lucky that the Canada actually, by the grace of Allah, that most of the Muslim physicians and other with collaborating with Diabetes Canada, we did came up with our position statement, how to manage type 1 and type 2 diabetes during the month of Ramadan. So this is a very good guidelines for us as a physicians, how we can help our patients. So when we got this guideline, I thought that we have to, of course, involve healthcare professionals as well as our community. And in Middle East, what happens 3 to 4 months before Ramadan, they start giving these structured educations to people who suffers from diabetes. So we thought not only diabetes, we should be just doing, general health conditions, because, whenever the Ramadan comes, we associate certain food with Ramadan. The food that we haven't eaten all year round, we just want to have in Ramadan, however healthy or unhealthy they are. So the concept of feasting comes first rather than the actual purpose of fasting. So one of the purpose to bring up this project, and inshallah, we tend to do more structured or an organized workshop, inshallah, is to actually revive the actual essence of Ramadan fastings, which is fasting, not feasting. As we already know, that the actual purpose of Ramadan, which we already know, is to acquire taqwa, which is the God consciousness, right? We know, we have learned the meaning that it is a shield that protects us from fire. So when it comes to food, we tend to forget that there is restraint in food as well. So just to get the deeper meaning of taqwa, I just want everyone to acquire when we are doing iftar, sahur, that other than the actual meaning, we are actually restraining from food as well. The other purpose to come up with this thing is, as Allah subhanahu wa ta'ala wants us to become a very strong mu'min as compared to the da'if mu'min, we need to bring the right kind of information and make our Muslim ummah more healthier, more stronger, more confident. And all of these things will come up with the right kind of an education. There's so many misconceptions. There's so many things that we think that invalidate our fast, that not right in fast, but actually they're not. So all of this, we try to cover it. So this workshop is part of the series of workshops that we are giving. There is a workshop that we just talk about general health and the general nutrition that needs to be done in Ramadan. We do talk about physical activity, sleep. Diabetes is the main core, which I will be covering in this presentation, as well as there are other diseases that we will be. Now, when we are preparing for Ramadan, as what the sunnah of Rasulullah sallallahu alaihi wasallam and Sahabas and Taba Tabain was that they used to prepare 3 to 4 months before. And that's what the guideline says, that we need to start preparing ourselves 3 to 4 months before, especially the people who are suffer from diabetes. So I know that alhamdulillah, we have a lot of Islamic scholars who do talk about spiritual and emotional preparation, but we took the burden to start talking about physical preparation when it's coming. So I'm hoping after 1.5 hours, I'm able to provide you information about basic diabetic knowledge. I'm able to provide you with information, who are the people who can safely fast and who are not, how to monitor blood sugars, what are the lows and the highs blood sugar, general aspects of diabetic care like physical activity, sleep, fluid, and inshallah, Shaistha will talk about the Ramadan nutritional plan, how we can adjust medications and insulin, and other health conditions. I know there's a lot of questions about health and nutrition, so what we'll do is that me and Dr. Shaikh will cover diabetes and health condition, and we'll ask Shaistha to talk about the nutrition in the end, and we'll take the questions soon after that. So when we talk about diabetes is very prevalent chronic health condition. And in Canada, 1 in 3 person either suffers from diabetes or pre-diabetes. So, if we have like 5 people in the room, the third one will eventually have diabetes and pre-diabetes. What is going on with diabetes? What's the problem? Just to understand the basic of it, whenever we eat food, when it goes to our digestive system and it gets, broken down into smaller products, there are 3 kind of products that comes up: fats, protein, and carbs. So the simpler form of carb is called glucose, and the body metabolizes the complex carbs into glucose, because glucose is the only source where it is utilized in the cell. Not any part will go in the cell, but only the simplified form will go to the glucose. The problem with diabetes is what's happening, that the body lacks the capacity to metabolize the glucose. So eventually we end up in a very high level of glucose in the blood because it cannot go in the cell. Now, the hormone that controls the metabolism of glucose is called insulin, and insulin is secreted by this organ called pancreas. Pancreas is located kind of back in our abdomen, just back of the liver. And insulin, I want you to think about insulin. It's a key. So it opens the doors for glucose to enter into the cell. So when we don't have insulin, or we have either a complete deficiency of insulin, which is type 1 diabetes, that the body does not make insulin at all, or the body makes insulin but does not make it enough. So it's not enough for the body. So what happened? The glucose is in the bloodstream. In normal people who have enough insulin, the key opened the doors and all the glucose can go in the cell and it's metabolized, no problem. The level of glucose is normal. In people who have diabetes, the glucose just roams around in the blood level because there's no key to open the doors. So the cell cannot metabolize the glucose. And that's why the people who suffers from diabetes and the sugar is not, they feel very tired, weak. Why? Because you have the fuel, but the body is unable to utilize the fuel, right? You have the running factory, but if you don't have material, what will happen? No material is found. So that's what's happening in people with diabetes. Now, how we measure or how we diagnose a person with diabetes, there's a lot of tests. So one test, which very famous, everyone knows, is a fasting blood glucose. You have done fasting in the lab. Your doctor says, fast, go check it in the lab. And your numbers are if above 7, then you're labeled as diabetes. Even when you check through glucometer, if your numbers are above 7, we call it uncontrolled. So that's pretty common test. Random, if you do random sugars at any point in time, if it's number less, more than 11, then it's diabetes. It's not normal. Then you have seen people who take insulin, they check sugars at 1 hour after food, 2 hours after food, and they have to meet the certain targets. However, I want you to remember this special test. It is called Hemoglobin A1c. Now, this is the current standard of the test to diagnose if you're diabetic or if your diabetes is controlled. So any person who suffers from diabetes, this is the number I want you to remember, because I want you to take charge of your health. Because Allah subhanahu wa ta'ala wants us to be confident. We should have ilm. So we should take charge of our health. So there are certain things you should know. What is your hemoglobin A1c is, what medications you are on, so that you can take active participation in your health. So what is hemoglobin A1c? So everyone knows that we have RBCs, red blood cells, that if it's low, it gives us anemia. If it's high, it's pretty good. So what happens if we have a high blood glucose level? Think of it like donuts. What happened? You have a donut freshly fried from the, pan, and then you glazed it with what? Sugar. So if you have a high amount of sugar, the sugar will start glazing the hemoglobin A1c. So the A1c is actually the 3-month average measurement of your blood sugar. So in this way, when people come to do the fasting, they don't eat for 2 days and fasting is all good. And if they have a dessert a night before, the fasting is high, and they say, oh doctor, I just had the dessert, that's why my fasting is high. And you think maybe, but now nobody can cheat us. So 3 months blood sugars will tell you what is your average of your blood sugar, and from this we can get an average where you're at and what is your predictability of become a diabetes. So think of A1c as a spectrum. So we would like to check everyone's A1c and tell them, if you don't change your lifestyle, you might end up, getting a diabetes. So the number that I want you to take home is 6.5. If your hemoglobin A1c, which is a 3-month average of your blood sugar, if it's 6.5 or above, officially you are a diabetic. Okay. Any number, if you want to live in a green zone and it's all good, any number below 5.7. So 5.6 and onward is a good 3-star number. Any number in between is you are a borderline or a pre-diabetes. And why? Because you can move on to the spectrum. If there's anything not changed, you can go move on and on a spectrum. If you start improving it, it will go back. So it's a reversible pattern, right? So what are the chances of a person getting into diabetes? Some say I have a borderline diabetes at some point in time. So if your A1c is not yet 6.5, but not normal, 5.7, and if your fasting is also abnormal, then what can happen is that in 5 years, if you don't change your lifestyle, what is happening? You're diabetic in 5 years. So we would like to identify these people and say, please, brother or sister, let's do something. We don't want you to end up, because once you're diabetic, you are a diabetic, even though your hemoglobin C is normal. We will put all the criteria, all the hudud will come, and the hudud for diabetes is that your blood pressure needs to be strictly controlled. Your cholesterol needs to be strictly controlled. So once you enter the hudud of diabetes, then your target of blood pressure and cholesterol becomes more narrower. So as long as you're pre-diabetes, we can work around with it. So this is what I want you to think. So especially my brothers and sisters, if you are pre-diabetes, we need to watch, because eventually it will end up like that. Now, as I said, any number, when it comes to us in terms of management, because hemoglobin A1c will tell us how aggressively we want to, and this is what I want you to know. If you suffer from diabetes or pre-diabetes, you should know your latest A1c. And less than 7 is pretty well controlled. That means you will not have any complications, hopefully, bismillah. But any number that is above 9, first of all, it cannot be controlled with oral medications. Mostly insulin is needed. And this is a level where glazing happens so quickly. And what are the organs that get affected with glaze? Just think about this donut, glaze. So if the sugar is so high, what will happen to the brain vessels? Stroke. What will happen to the heart? Heart attack, blockage. What's going to happen in our circulation? Our circulation will get impeded. The nerve get glazing. So, there's something called as, people will say, I have this numbness, tingling, burning in my feet. Why? Because the nerves are getting glazed, right? So what is the red number here? 9. 9 is poorly. And, eyes, blindness can happen. Kidney function can get deteriorated. Diabetic foot, the wound healing get impaired, right? So this is what. Now, if you plan to fast, this is not 3 months before. This is something you want to take care of yourself all year around, right? So if your sugar is 9 and over, and I'm going to go over it's a safe or not. So anytime you do a blood test, you should know what your hemoglobin A1c is. Can I fast next Ramadan? Because then these people becomes very unsafe to fast, because the body does not know how to handle lows and the highs. So when we start educating our patients, the guideline actually tell us that we need to give a very structured education. And Dr. Hasnan and his team came up with this word called READ, Ramadan Education and Awareness in Diabetes. And they come up with the 7 key things that they want every person to know about it. And I'm going to go one by one. And they say that at least the preparation of if somebody wants to fast in Ramadan, they have to prepare themselves 3 months before. right? It's not going to a day before. So the first one is to know, am I safe to fast? Because some diabetes, they're well controlled, no problem. But if it's uncontrolled and there's other co-diseases, one has to be very careful. So I want you to think about which color are you in, So the red one is the high risk people that we say that as per the physicians, you should not fast. You will have higher chances of complication, hospitalization, and even death. And the three ones are pretty low risk. You can fast, but of course, you need to talk to your family physician, your doctor about it. And what we have an experience, and Dr. Shaikh will also say that we find two extreme of people. So that the green ones are those who, so the people who would be on one or two medications, they say, no, doctor, I cannot fast because I have diabetes and I have medications. I cannot fast. And these are the people who are very safe to fast. So this is a misconception, right? But there are people who will have uncontrolled diabetes, insulin, kidney failure, and they will insist, I need to fast. And you tell them, it's not it's not safe for them, but it's hard. So this is the kind of a real world people, and that's what we are here to educate them, that if you want to fast, then you need to work hard or you're around. So let's talk about what are the definite no's. So we call them high risk and they should not fast. The first one I already told you, any hemoglobin A1c, especially if you're on insulin of A1c of 9 and over, unsafe to fast. That means the body does not have any capacity to accommodate the long hour of fast. And this year, how long of a fast do we have? Above 16, more than 16 hours, right? So the body cannot compensate that. And of course, this is one of the most important things. If you have a recurrent history of low blood sugars, first of all, you don't know when the blood sugar happens, like no symptoms and frequent history, then it gets very dangerous for these people. Then if last 3 months, if anyone ended up in a hospital with diabetic coma, probably their body is not good enough to kickstart for diabetes, so they're not fast. Any normal diabetic, well-controlled, if he ended up with an acute infection, let's say a day during Ramadan, you had a bladder infection or a pneumonia or a COVID, then you become acutely stressed. So this time it's not safe for you to fast. Then who are the ones that we say you're safe to fast? The green ones. So well-controlled diabetes. If your doctor say, your diabetes is not too bad, it's diet controlled, pretty good. You can fast because you're not on any medications. And your type 2 diabetes, just on 1 or 2 oral medications, but well-controlled. And what is the number, sisters? What is the number I want you to remember? 7. 7 is well-controlled, right? So 7. So even if you're on once a day insulin, if you aren't taking an injection or you're taking 1 or 2 or maybe 3 oral medication, as long as you're 7, you're good to fast. But your doctor needs to know. These people are very tricky, the amber people or the yellow ones. They are the people who are type 1, who are on a continuous insulin, but well controlled because we want to monitor them. But anyone who are in middle between 7 and 9, so these are the people whom we really want to be doing a regular follow-ups. And of course, our sisters who are pregnant, Allah subhanahu wa ta'ala has already exempted them, but it's their choice. But if they're on insulin, then we put them in a red zone. Any questions so far? So I want you to write down your questions and we'll take it in the end. So just to make you remind, alhamdulillah, we are well aware of this verse. So Allah subhanahu wa ta'ala says that, وَمَنْ كَانَ مَرِيدًا, and whoever is sick. The first choice Allah subhanahu wa ta'ala is that when you're better, you make up that fast. Right? So he has exempted us because Allah subhanahu wa ta'ala knows us that it's not fast. So when a person is normal, their body knows how to compensate long hour of fast. Liver knows how I can compensate and convert myself into, sending glucose. Muscle knows how to do that. But people who have diabetes, they don't have these compensatory factors. It's gone. That's why they become sick and ill. So they will come into that. So when they were making this guideline, Diabetes and Ramadan Alliance, they actually consulted with a lot of muftis. And because this was originated from Egypt, so they did contacted the mufti's office, and the Canadian Diabetic Association actually got endorsed from ISNA. In the end, all the scholars, as anonymously agreed on this thing, that when your physician, so it is worthy to be noted, it is the end of the conclusion of this fatwa, that it is worthy to be noted that in all three types, the patient should follow the physician's prescription. If he finds that he should break the fast, a person should break the fast, and that if the fast is too risky for them. So in the end, if your doctor says it's not safe to fast, it's not safe to fast, and then Allah subhanahu wa ta'ala will consider you as exempted. But yes, we know that some condition will not get better over time, right? So maybe a person cannot make up the fast. So don't forget, there is a fidya that one has to pay for it. Ideally, one has to, make up, but if not, if it's a lifetime issue, then fidya. And, just a few things to remind you, and I know that, mashallah, you all know this, but, if Allah subhanahu wa ta'ala has put you in that condition, there must be a reason. Right? So inshallah, he will equally reward you for your other actions. So don't feel bad about it. Also, there's a lot of alternate actions that you can take during Ramadan, right? Even though if you cannot fast, then you can avail the Laylatul Qadr, the last 10 days. And don't forget this, that if your doctor said that it is not safe for you fast and you're putting your life in danger knowingly, then it is considered as what? It's a sin. Right? So don't forget that. But in the end, we understand as a physician, we understand this, the special thing that Ramadan has for us. It comes once a year. We respect all your feelings, your emotion towards it. Even though we said that you cannot fast, but if still you fast, we will still respect it. But let us know. Don't hide it from us. We can make a plan. Maybe we can do a regular follow-up visits with you. So make your physician aware of it. Maybe you have a physician who's not a Muslim, but this is a way that he'll know, because that's why the guideline has come, to inform each and every physician. So they don't think that your physician doesn't know about it. So we will accommodate you, but let us know that you plan to fast. Okay. So let's talk on to the second thing, monitoring blood glucose level. So the most common thing that everyone will monitor is through this device, right? It's very common, You have a glucometer and you prick your finger and then you monitor. Now tell me, does pricking your finger, would it break the fast? No. Really, sister? Oh, it's not going to break my fast? So yes, because nothing is going in my stomach. I'm just breaking my skin, and there's a reason I'm doing it, right? So actually it would not break the fast, because some people would just don't do the finger prick, is they think that it will break the fast. So this is another misconception. So this is a common device that everyone uses, but I want to make you aware there are more better and less invasive devices. So the other one is called the flash glucose monitor. So it's good for 2 weeks. So you have this sensor here, you put it back of your tricep muscle. There's a trigger there, you put it there, and then you download this app either on a phone or a reader, and you can check whenever you scan it, it shows your blood glucose level. So you don't have to prick it. And we have it in Canada, and mostly it is covered by government program if you're on insulin. But I usually tell my patients that if you have a drug plan, especially in Ramadan where you want to monitor your sugars quite often, this is a good one to go. Another pretty good device is called continuous glucose monitoring. So again, you have a sensor. It's good for a month, but this is continuous. So anytime you see your phone or your reader app, it shows your glucose reading second by second. You don't have to scan it. It shows you 24 hours each second. So this is something very interesting, and this is something you can talk. It's come by the name of Dexcom, and most of the insurance does cover it. So think about it, getting these devices. Now, how often we have to monitor your blood glucose level? This is important, because if you're on diet control, if you never monitor, maybe in first few days of Ramadan, it's a good habit to monitor your sugar. So maybe, in the beginning, 2 times a day, just maybe before sahur, after sahur, before iftar, just to know your numbers. And I'll talk about the targets later. Then anyone who is on simple regime like oral medication or just injection, maybe 2 to 5 times a day, just in the beginning, just to know how your pattern is coming along. But anyone who is on insulin, we tell them to go often more frequently, right? And anytime you experience a symptom. So the good division would be before sahur, after sahur, sometime midday, then asr, maybe before iftar, after iftar, then before tarawih, during tarawih, and then, just around that. So these would be a good division. And why we want you to do that? This is very important, because another misconceptions that people will say is that, Dr. Saima, you're telling me to monitor my blood glucose. Eventually, I have to break my fast because you're telling me to monitor 4 or 5 times a day. And then, I'm doing it so many times. Eventually, I will break my fast. This is a common misconception that if the physician asks a patient to frequently monitor blood glucose level, that means we are gone. This is the thing. But actually, the research says very different. They say the people who monitor during Ramadan, first of all, it reduces the rate of hypoglycemia. So they will not break the fast because, you have a fast, your sugar goes down and you have to break the fast. Just think of the psyche, what will happen to that person? Anger, shame, I couldn't make it. What happens to me? Like blame on the willpower. Right? But if you can prevent hypoglycemia, if you know if sugars are going down, you will not walk, you will not do stairs, you will just sit because, I have only 2 hours to go and inshallah, I'll be okay. This will prevent you not to go into hypoglycemia. And after Ramadan, the hemoglobin A1c actually improves because if you know your sugars are getting high and low, what will you do? You become more wiser in your sahur and iftar. So it actually helps, right? So this is another misconception. People say the ignorance is a bliss. Rather I'll not do my blood sugars because, if I do my blood sugars, then I'm going to be doomed. But research actually says very opposite, right? So what are the signs of lows and the highs? This is a very important. The most common thing that people will get is a low blood sugar. So anytime your number is less than 4, it's a low blood sugar. Depending upon the severity of the symptoms, you can start from here and end up in a very severe symptom. So the most common symptoms, and this is not only for low blood sugar, if you have low blood pressure, it's the same symptoms, right? So most commonly sweating, trembling, palpitation as the heart is racing, irritability, anxiety, nausea, headache, numbness, tingling. And of course, when it's very severe, it can go from vision difficulty to an unconscious level. So at 4, obviously, we need to break the fast, right? But these are the things that one has to monitor. So how to, and now I do have a copy, and if you would like to have a tier of pad and PDF, please give your names to the organizer. I'm happy to send you. Otherwise, in the end, I have a website, Diabetic Canada, and you can download these PDFs for free. So it's from the Diabetes Canada website. And what's happening when you start to feel low is, and you check your blood glucose level, and if it is below 4, you need to do something about it. And it is very specific sugars that you have to consume. You're not going to consume a biscuit or a sandwich because it will take time to affect. So you need to have, the best thing is to have a 2/3 of a glass of a juice, because as soon as you drink juice, your sugar level will come up. Not only not just only the tablespoon of sugar, it has to be dissolved in water. Some people just take a tablespoon. No, it has to be dissolved in water and then take it, because you need a quick energy. The reason we need you to get your energy back, because the brain will get foggy and unconscious. The brain needs the sugar. So if it's less, you're causing the brain to go into a coma. That's why we want people to have their blood sugar more than 4. And this is a common thing when you have a long hour of fast, and if you're diabetic and it's controlled, this is the lows that's happening. The high blood sugar. High blood sugar, any sugar more than 11. Now, it doesn't mean that you have to break the fast. Break the fast will happen at 16. I'll go over it. But at 11, start monitoring. So same symptoms almost. You will feel more thirsty, more weak, headache, dry mouth, which is almost similar at the low. But here, when you check your blood glucose and you find it's higher than 11, we recommend most of the people to start doing a little bit of exercise, start walking. So it brings the sugar down, because the more the sugar higher, the more symptoms you're going to feel. If anyone is in insulin, this thing you need to talk to your doctor about, how much of insulin you need to take in order to bring your sugar down. So this, I'm not going to go over it. And start checking your blood sugar. Now, this is what I want you to take home. Why a person gets a high blood glucose. Food, activity, and medications, when all these things are not balanced, one get a high blood glucose. And what is happening in Ramadan? Is your food proper? No. Is your activity proper? No, because what's happening all day long, we don't do any activity, and then we have a hoop, 1.5 hours of good Tarawih activity, right? So it's imbalance. Also medications, because we're not used to taking medications in Sahur and Iftar. First 5 days, believe me, most of us are forgetting their meds. And that's why we ended up high. So this is something, so that's why I want you to monitor. So when we recommend that you have to break your fast, even though you're not feeling any symptoms, but you check your sugar, because being a good people, when we told you to monitor frequently, you did it, and your sugars are less than 4 and more than 16, even though you're not feeling anything, you need to break your fast, even though you're not feeling anything, because the body cannot comprehend these much of a high sugar. Okay, then of course you're vomiting and you're having diarrhea. What's happening in there? Both of the openings are open, so you're dehydrating, right? Dehydrating, and again, body cannot compensate that. Of course, anytime a diabetes get a acute infection, so COVID, flu, pneumonia, strep throat, bladder infection, abdominal infection, whatever the case would be, we don't want you to fast, maybe break the fast. And of course, the symptoms of low BP, and if you're just not feeling right, because you don't know how it end up like that. So you break the fast. Of course, you have to make up the fast later on. You hold your medications and insulin. And of course, you continue to monitor your blood sugars, and you have to call your doctor. And hopefully you have already discussed with your doctor, hey, doc, I'm fasting. So his staff and everyone is open to that you call in the middle of the day. So he gets back to you, right? So we did talk about the misconceptions, but this is something I want to, again, the studies have shown a person who monitor blood glucose on a regular basis, they would not have hypoglycemia. They will have a very pleasant experience of fasting, and they're very eager to fast next Ramadan. And it improves their hemoglobin level after Ramadan. Okay. Good. So moving on to the next topic. Does that make sense to all of you? Yes. And it gives more empower, right? That we know how to manage. And even though if you're not diabetes, this is a good dawa thing that you can tell it to others, right? Who has diabetes or pre-diabetes, that what they need to do. So in terms of medication adjustment, what are the common medication that people would use? Anyone who would like to say the names? Metformin, yes, alhamdulillah. So before I go and talk about the medications, I want you to know that this is just a simple guideline. Everyone has to make an individual plan with their physician. And it has to be not 1 day before, not 10 days before. How many days before? At least 1 to 3 months. Yes, but thank you for listening to me. So the message I want to take, that everyone's different. Their sugar control, their targets, maybe the doctor give you a different target. So what I'm going to talk about, it's not engraved in stone. It's just a preliminary guideline. You have to talk to your doctor about how to adjust your medication. But the simple rule is anybody who's on metformin, the other name is glucophage, very safe. No dosage need to be changed. If you're taking once a day, continue once a day. If you're taking 2 times a day, continue 2 times a day. If you're taking 3 times a day, you probably need to omit your lunchtime dose because you're not having lunch. Simple. The other medications, the names are pretty good. So Januvia, Onglyza, Trajenta. So, in order for you to be empowered, the first information I told you to remember your hemoglobin A1c. The second information, I want you to know what medications you're on. You should know the name of the medications, what you're on. Don't know, okay, I don't know. So at least have the name. So these medication, again, very safe to know. They're only once a day, and whatever the time you're taking it once a day, just make sure you take it on a regular basis. The another commons are Jardiance, Invokana, and Froxiga. Again, they're once a day, very safe to take. However, there's a bit of a glitch. When you're taking on these medication, make sure you talk to your doctor, because in some people who have certain condition, sometimes the doctor wants the dose to be reduced or hold or same. So if you're on these, make sure that before making any decision, talk to your doctor. But most of the time, it's pretty safe to take. Now, these medications are not commonly used in Canada. This is mostly used in South Asia and Middle East countries. So I see a lot of patients who come from these countries on a visit visa, visiting their families. They are on these medications. So again, you need to make sure that you talk to your doctor, but these are pretty safe to take. There's no changes in the doses too. Now, this one is most common back home, South Asia and Middle East. Some of us also prescribe it here. Now, this one is very challenging. Diamicron or glycoside, one in the same thing. This has to be reduced or switched because it has a tendency to put your blood sugars to low. So if you're on this, please talk to your doctor. What's the plan about it? He will tell you whether he is planning to switch it, or he's telling you to hold it or reduce it or whatever. So this is what I want you to remember. It is being prescribed in Canada, but not many of us do that. But I want you to remember that. Now, I don't know if you know there's some injections. So these are injections. They're not insulin. These are injections to control your diabetes. It could be either once a day or weekly by the name of Victoza and Ozempic, very commonly used. And also they are now approved for weight loss agent. These are very safe to use. So no need to change the dose. However, because sometimes your doctor is in a process of titrating it, we tell them not to titrate just few weeks before Ramadan, right? So this is something you want to talk to your doctor. So the take-home message is I would say 80% of the oral diabetic medications are safe, no need to change. There are few that you need to bring that discussion to your physician. Okay, just 101 about insulin. Any person who is on insulin, yes, the dose need to be reduced. So how much, at what time, that you have to talk to your doctor. I'm just here to tell you. So most people who are just on once a day insulin, yes, those need to be reduced. Any person who is taking insulin with meals, depending upon how much carbohydrates you take or what's your glucose is, your doctor will tell you. But again, yes, the dose most probably will be reduced or may remain the same if your food content is the same. So I'm not going to go into detail, but take home message for anyone who's on insulin, likely the dose will be reduced. Please talk to your doctor about it. Okay. Let's talk about physical activity and sleep. What's happening in Ramadan? Our sleep is more or less. So if our sleep is less, then we know that lack of sleep also interferes with blood sugar, right? Because more stress is there. So it's a proven fact that our sleep get reduced as well as interrupted. So normal people, non-Ramadan, say good straight hour of sleep. But in Ramadan, what's happening? Interrupted sleep. Plus, so that there's interruption in sleep as well as the total sleep time is also reduced by average of 1 hour. And that also influences the blood glucose level. The question is how we can able to get the benefit even though our time is less. So the recommendation for almost everyone, including diabetes, is to start doing the power nap, which Rasulullah Sallallahu has told us 1400 years ago, is that do a midday nap, siesta. So the modern word everyone is calling a siesta, but we know that. So how much of a power nap is a power nap and beneficial? Anyone can tell me the number? 10 minutes, 20 minutes, 30 minutes, 40 minutes, 60 minutes? Power nap? 30 minutes, 60 minutes, 10 minutes. So when we say power nap, Power nap is 20 minutes. We don't want you to hit 30, 45, 60, and I'll tell you why. So one has to understand a sleep cycle in order for us to appreciate. So what's happening when a person goes to sleep, power nap less than 15 minutes, you actually do not go into your deep cycle. We don't want to people go into deep cycle. So less than 20 minutes, you're usually in a very, it's kind of superficial. And 20, at most 20 minutes, you wake up, you feel very refreshed. Your attention span is good. And for the next 8 hours, you're good to go. So especially with people who are diabetes, who get sick and not feeling well, 20 minutes power nap is very important, or for every one of us. It will come with practice. First day when you wake up, you will feel very groggy, but it will come with practice. So practice makes progress. So, but why we don't say 30, 45, 60 minutes? Because you are in your deep sleep. When you wake up from a deep sleep, this is something we say sleep inertia hits you. What is sleep inertia? As soon as, have you noticed that after 30, 40 minutes, if you wake up, you feel very groggy, very tired. You feel that somebody has literally woke you from deep sleep. It takes you like 3 to 4 hours to actually get to your senses. So power nap is 20 minutes or less, or you hit good 90 minutes where you actually completes your sleep cycle. So you take each and every bit an advantage. You take the superficial sleep, deep sleep, you take the REM sleep as well. So the take home message is power nap less than 20 minutes, or you hit 1.5 hours of sleep and then wake up. But practice. It's not going to happen. So recommendations, especially for people with diabetes, please do a midday nap. And if you look at the words of the hadith, it said take a nap. So it's fail amal. Rasulullah is actually telling us to do that, right? So it's a sunnah. Now we know that most of the big companies like Nike and Google actually install this sleeping pods in their restroom. China, Tokyo, Japan, everyone, and it's 20 minutes of power nap. Right? Fluid and diet. So I'm going to give this to Shaistha later on. But right now, I'm going to ask my colleague, Dr. Sheikh, to talk about it, about health and other conditions. The other thing I want to go over is physical activity, which just a quick thing. If you're already doing a physical activity, then don't stop it, okay? Because it's hard to get back on a track. So it's better that if you do every day, maybe reduce the time, but do not stop it completely. Second most important thing is Taraweeh is considered as a physical activity. So Taraweeh is a physical activity. Second thing, during Taraweeh, please monitor your blood glucose, because this is something we tend to forget. Taraweeh is an exercise, so make sure you have a glucometer and your, if you get lows, sugar tablets in your purse when you're going for the mosque. Second thing is plan ahead. Because sometimes we have a niyyah to do only 8 rakas, but we end up doing the 20 rakas and nobody knows that. So it is very important that you organize and you plan ahead when you're doing. But physical activity, Taraweeh is almost the same. And if you're doing a physical activity before Ramadan, please don't stop it, because it will be harder for you to get back on the track, but maybe reduce the time, maybe 25% of the time. So I'm going to ask Dr. Naureen to talk about the other diseases in Ramadan.
I don't need this. I'm good. Just need to move the slides. That's there already. You'll do that? Thank you. Assalamu alaikum. Jazakallah, ladies, especially Al Huda Institute, to give us this platform to speak. And thank you, Dr. Saima, for such an informative session. And this will be followed by our dietitian, Shaistha. She'll be telling us about healthy tips and what to do in Ramadan. I'm just going to move forward with the few conditions that are very common in most of our patients. So what we've done, as Saima's explained them nicely, detailing the description and everything, I haven't gotten into the details of the diseases. What I've done is, what our team has done is we've laid down a plan, whether it is safe to fast and what are you doing with your medications and what are the symptoms that need to be monitored. So first very common condition that we come across is high blood pressure. yes, it is safe to fast with this condition, but people usually are on medication for this condition. So what happens with the medication? The dosage doesn't change. More close? Okay, my apologies here. Is this better? Okay. So one of the conditions that we're talking about is high blood pressure and whether it is safe or not to safe to fast or not to fast. Yes, it is safe to fast. People on medications, usually the dose doesn't change, but some medications, especially you must be familiar with the common medication, which is Lasix or furosemide. It is a water pill that might need to be adjusted. So as Saima has been reiterating, I'm just going to enforce it again, that once you have blood pressure or any medical condition, pay a visit to your family doctor. Go there between at least 1 to 3 months, ideally 3 months. But if we are cutting short at least 1 month prior to start of Ramadan, make sure your blood pressure is therapeutic. By therapeutic means that your levels are normal. If you're on medications, your medication, if they need adjustment, we have enough time to adjust the medication. We can call you frequently and do follow-ups on your blood pressure. One key point for taking medications for blood pressure is that you should be taking your medications regularly, same time. If you're on a water pill or a medication that is acting as a diuretic, is removing fluid from your body, you should be well hydrated. Shaistha will be talking about how well hydrated you should be and what's the amount of fluid as per weight you should be taking. Being hypertension, your salt intake should be decreased. Monitoring blood pressure at least once a day, and your systolic blood pressure, if it is less than 90, being mindful, not necessarily that that is concerning, but be mindful that if you're having any symptoms like being lightheaded, dizzy, feeling sick, blurry vision, generally weak, try adjusting the dose of the medication or bringing it to your physician's attention. If necessary, if the symptoms are not getting better, you can break your fast and then make it up later. Other medications that Saima has gone over is Jardiance, Foxygen, Vocana, because they act by causing diuresis too. So we should be mindful with the being on blood pressure medication and these medication if the medication needs to be adjusted. Other heart diseases, again, it is safe to fast during the heart diseases. Medication dosage doesn't change. Some patients are on multiple medications and multiple dosage of medication. It'll be nice to speak to your physician. They can decide when to distribute the medication, whether you should be taking it during the daytime or during the nighttime. Some of the medications patients usually have questions during fasting is the nitro spray and nitro patch. Nitro spray does not break your fast because what's happening, it is going sublingually. It's going under your tongue. You're not swallowing it. It's going under your tongue, fast absorption in your blood and goes to the heart and does what it needs to be done in patients, especially with angina pectoris. God forbid if you're having a heart attack. God forbid if your symptoms are not resolving, then obviously then you need to break the fast. But if you're having symptoms and you're using the nitro patch or the nitro spray frequently, please bring it to your physician's attention. To continue with your heart medications is very important because it improves your cholesterol levels, which is again beneficial for your health. Thyroid conditions, many of our patients are on thyroid medications. It is safe to fast with this condition. Levels of thyroid hormones, which are TSH, T3, T4, which you must see your physician monitoring, they don't change during Ramadan. Medication dose doesn't change. Being mindful that has to be taken regularly. With thyroid medication, it's a little tricky because the absorption is disturbed by other medications and food. You should be taking it at empty stomach. One simple advice would be to take 1 hour before sahur, like when you get up, take it. So that gives enough time for the stomach to absorb your thyroid medication, and an hour before going to bedtime. Again, your stomach is empty, so you can better absorption for the medication. Thyroid levels, TSH, do not need to be followed during fasting. Same set routine, schedule test after Ramadan is needed. Another common conditions that most of our patients have is gastric ulcers, reflux diseases. Again, safe to fast. You know your body well, you know your triggers well, avoid triggers, manage them. One way of disciplining yourself, avoiding fatty foods, fried stuff, citrus food, especially at iftar time, taking small meals, that is beneficial. Reducing caffeine. One of the habits that, especially I know about females and myself, I have this habit of having tea or coffee first thing in the morning. Train ourselves now to avoid the withdrawal headaches. At least these symptoms will last 3 to 5 days and then they go away. So we still have time. So stop using the caffeine, stop using tea, coffee. One thing that you can do is if your habit of drinking is something, hot water with lemon, beneficial for your health if you're not told to avoid citric food, or decaffeinated drinks. If you're taking medications, you can take them 30 minutes before sahur, be regular. And some patients, some of the lifestyle changes that we can do is lifting the head end of the bed before going to bed. That will keep the acid and food in the stomach and let it go through to our intestines. And avoid wearing tight clothing and try wearing loose clothing during Ramadan. As it is, we should be wearing loose clothing. Other common condition, irritable bowel syndrome. It's a condition where you have abdominal discomfort, which is associated with diarrhea or constipation. Safe to fast. Again, know your triggers, maintain a routine, sleep properly, meals which can trigger your IBS, irritable bowel syndrome. Try avoiding those meals. Staying hydrated is one of the tricks to avoid flare of your irritable bowel syndrome. Low fat MAP diet is one of the common diets. I have a copy of that diet. I printed it out from Up to Date. I can share it. And Sam, if you're sharing something, I can give it to you. You can give it to the authorities and they can email it to them. There's a website that you can get that diet from, ibsdiets.org. Bowel movements, minimum of, we'll speak more in detail in constipation. Bowel movements are minimum 2 per week, and we have a nice chart which shows how this tool looks. So if somebody who doesn't like looking at the chart, please don't look at it. Did we bring that chart up? Coming up, okay, just a disclaimer, if somebody doesn't like looking at poop, please close your eyes. So constipation and hemorrhoids, one of the very common conditions that we go through regardless. With the change of our diet and sleep and eating habits during Ramadan, we can end up with constipation or flare of our hemorrhoids. Minimum bowel movements everybody has their own bowel routine, but at least 2 bowel movements, like a bowel movement, full bowel movement, 2 per week. Bristol stool is basically the quality of the stool, how it should look. It's number 3 and 4. We'll show it to you right now. If anybody has issues with constipation, Metamucil, your Isabgol or Laxaday, the recommendations are on the bottle. But what you should be doing is taking 2 tablespoons of fiber and mixing it in half a cup of water and drink water, additional water. The term which is used, chug and chase, means you're taking the fiber and chasing it with water, because stir it and don't wait for it to solidify. Drink it soon, because we want the action, the actual gel formation happening in our system. Increasing the fluid, increasing it by twice a day, and it will take effect in about 3 to 4 days. So if you're a person who has constipation, take it on a regular basis. I'm just going to grab a water. So this is the image that we are talking about. 2 extremes to look at is the number 1 being, if you're severely constipated, you'll have pellets. Type 7, that's type 1 when you're severely constipated. Type 7 is liquid consistency when you're having severe diarrhea. Normal is 3 and 4, where you have the sausage-shaped stool, and number 4 is a smooth, soft sausage again, sometimes like a snake. Other common condition is migraine and headaches. Safe to fast during migraine. If you have migraine and headaches, you can break your fast if it is severe enough. Common triggers are, if you're not having proper sleep, any meals can bring your migraine back. Dehydration, so make sure you're hydrated well. Caffeine withdrawal, which we've already spoke about. Medications and anti-nausea medications in injection and suppositories are safe to take because we are not swallowing it. Sublingual tablets, some of the your physicians will prescribe them. They're safe to take. Ondansetron sublingually because you're not swallowing it. Again, the same concept that it's being absorbed under the tongue, going in your bloodstream. It's not going in your stomach. 1 to 2 tablets of Tanolol at Sahu time is okay to take. Other things, most of the patients, some of the patients, if they have too many migraine attacks, your physician prescribes you prophylactic medications, which could be propranolol or other medications that you can take at Sahu time. Asthma and COPD, again, chronic obstructive pulmonary disease, a common condition. Again, safe to fast. What do you think? Do the inhalers break the fast or they're okay to take? Agreed. But again, the site and the mufti that we are following, we are not swallowing it. It's going to your lung pipe. It's not going to your stomach. It's not providing you nutrition. So it's not breaking the fast. So if you're having symptoms of asthma, where you're having cough, shortness of breath, which is not being maintained by like other things that you do to stabilize it, it's okay to take your inhaler. Again, stay well hydrated at Sahu time. Keep hydrating yourself, and medications that are prescribed, take them at Suhoor or iftar time. If you're having a bad flare and the inhalers are not helping, you're having short of breathness, the condition is not being stabilized, break the fast, get in touch with your physician, and you can always make up the fast. And again, if your conditions are not stable, pay a visit to your family doctor prior, get your lungs checked, your heart checked, whether the dosage of the inhalers or medication needs to be adjusted. Smoking, mostly common in men. Alhamdulillah, like most of the females don't smoke. But nicotine withdrawal symptoms, the peak happens 3 to 5 days. The symptoms last for about weeks to months. 4 weeks prior to Ramadan is an excellent time to start practicing to quit smoking. What is Ramadan about? Obviously, it's about self-restraint and practicing healthy habits. This is a time when we are trying to establish new habits. We are trying to control our nafs. So this is one of the habits that we can control. And why would we want to sabotage this when we've already taken into practice refraining from smoking? May Allah subhanahu wa ta'ala give us courage to keep continuing stop smoking after Ramadan. Ramadan, one of the side effects, one of the effects besides getting agitated, anger issues, anxiety, depression, sleep problem, weight gain. As it is, you're doing some sort of food restriction, calorie restriction in Ramadan. So the side effect that you get from refraining from smoking is weight gain. That'll not happen. So hopefully stopping smoking during Ramadan will be beneficial for all of us. Women's health, most of us are familiar with it. Menses, obviously, we don't need to fast. Any abnormal bleeding and abnormal pattern like prolonged days, change in the color of our bleeding, change in the consistency, different from our normal menses, any smell, clots, you can fast. And just make sure if you have questions, you can speak to a religious person or any resources that you can connect with. We got our answers from Question and Answer Islam, is it? That's the website that explains very nicely. Pregnancy and breastfeeding totally depends upon the individual. If you are healthy and you can fast, please go ahead. But if you have any other medical condition that needs to be monitored, there is rukhsat. We can fast late. We can make up for the fast later. Okay. Jazakallah, ladies. I'm going to hand it to Shaistha. And if you have any questions, we'll answer them at the end.
I would just like to introduce my colleague here, Shaistha. So before I put Shaistha on the table, I have to say, introduce her, because without her, I was not be able to present with that. So Shaistha is a certified registered dietitian accredited in Canada, US, and UAE. She has been practicing as a clinical and a community dietitian for the past 9 years, and she has established moderate nutrition in Milton to empower people to nourish themselves and their families. Shaistha incorporates in her consultations, she is probably encouraging people with the Quran and Sunnah. A lot of her teachings of food and stuff has an incorporation of the Islamic education as well. And I have been working with Shaistha for the past 3 years, and each and every projects that I do with Shaistha, without her help, I was not able to. So anytime I come up with any project for my weight management or my diabetes, I ask Shaistha, and Shaistha is always there for me saying labbaik. So all my duas and blessings goes to Shaistha. So thank you, Shaistha, for all your help. And I hope that we can work together in a long time and our community can benefit from you. Jazakumullah khair.
Assalamu alaikum. Thank you so much, everybody, for joining me. And thank you, Dr. Saima, for all the kind words. So today, based on this presentation, I'm here to talk a little bit about diet as much as I can. Inshallah, I'll try to make life a little simple. I don't know if I'll make it simple, but I'll try to explain it in the best way I can, inshallah. So we'll start with fluids first. I think we all talked about being hydrated. Dr. Naureen and Dr. Saima both mentioned how hydration is very important. And I think we all know that, right? When Ramadan comes, we know that we will get thirsty and we try to be hydrated. Now, one question I have for all of you is how we know that we have to be hydrated, but how can we stay hydrated? Do you have a plan? Do you have a strategy that's working for you? Anybody? Drink water at suhoor. Okay. Any other things that you try that works? Eat less spicy things. Less fried things. Yes. And did you want to say something? Lassi. Wonderful. Yes. So yes, there are so many. Absolutely. And it's very, very, very important to stay hydrated. Not only for people who have diabetes or on medication, but in general. This is a rough idea that tells us how hydrated we are. So generally, depending on the color of our urine, we can tell if we are doing well or not. So if you see, if you're on the top, around this pale yellow or lightish yellowish color, then we are doing a good job. That means we are well hydrated. But anytime it gets a little darker, when we get to the golden color, we start noticing that this is the time you need to drink water. Of course, in Ramadan, while you're fasting, you can do that, but this is just a guideline to give us a rough idea of how hydrated we are. And then the darker the color gets, the more water we need, of course. And at some point, you might even need medical attention if it's too brownish in color, and that's not healthy, it's not good. So one strategy that one sister, I believe her name is Nazima, she's in Toronto, she came up with this, and I love it, and I share this all the time, is create a system. We need to create some sort of a schedule or a system. I usually say keep a water bottle. The thing is that our body cannot tell the difference between hunger and thirst. Many times we are thirsty, but we think we are hungry. And by the time we actually know that we are dehydrated, it's already too late. We already have dry lips, dry mouth. It's too late. We should have had water a lot before that. So the idea is when it's out of sight, it's out of mind. So always keep a water bottle or a glass dedicated and say, okay, this is my mission. I usually keep like a 1 liter water bottle and say, okay, I need to finish 2 in my day somehow. So that's sort of one thing. Another strategy is, depending on how much fluids we need, mostly we need about 2 liters, women at least, roughly 2.5 to 2.5 liters. But you can actually calculate that. If you want to know specifically how much water you need, you just take your weight in pounds and multiply that by 15, and that'll give you how many milliliters of water you need. You can do that with kilograms too. You can multiply your weight in kilograms by 35, and you'll get the same amount in milliliters. So roughly, like I said, for women, it's about 2.2 or more, and for men, it's usually around 3 liters. So about, let's say, 2 liters. So that's minimum 8 cups daily. So how do we spread that? So what we can do is have about 3 cups of water at suhoor. So it's a good habit, even starting now, because Ramadan's just 2 weeks away. What we can start doing is start keeping a water bottle or a glass of water next to our bed before we go to sleep. And the moment we wake up, drink the water. Instead of heading to your phone, head to your cup or your bottle. First thing, wake up, drink 1 or 2 glasses of water. And during suhoor, when Ramadan comes up, inshallah, you can start doing that as well. Drink 2 cups of water, have your suhoor, and then have 1 more cup later. Or if two cups is too much for you, start with 1 cup, and have your suhoor, and then have 2 cups later. And then during iftar, when you open your iftar, start with at least 1 or 2 cups of water. So you already got 5 there. And then by the rest of the night, between Taraweehs, with every prayer, have a little bit of sip of water and try to finish the remaining amount, whether it's 3 cups or 5 cups, whatever it is for you specific. Okay, now I'll talk more about nutrition. The goal of nutrition from the READ and the DAR program, it's very important, like Dr. Saima mentioned, that education and structured education before Ramadan about how to fast, what to eat is very important. It not only helps reduce chances of hypoglycemia, which means low blood sugar, but also helps us control the amount of sugar between while we're not fasting. Especially after iftar, our blood sugars will rise very much. So making sure we know what to do to avoid that. So we talk about how to balance your calories and your carbohydrates and your other macronutrients. Also, we have to consider comorbidities, like Dr. Naureen mentioned, different, if you have high cholesterol or hypertension or some other issues, we need to make sure we know that and address that. One good news is for people who are, trained or explained like we are explaining today, it shows that people who get this education early have better control of blood sugar levels, but also lose weight in Ramadan. Although Ramadan is not the best time to try to lose weight, but it's definitely something that's possible if it's done right. Okay, so my question to you is how many. Okay, so roughly this is the calories that we want to do depending on what your goals are, if you're trying to lose weight or not. So roughly for men, if you're trying to maintain your current weight, the calories are about 1,800 to 2,200 calories. But if they're trying to lose weight, it's 1,800 calories. Now for women, depending on the height, if you are above 5 foot or 150 centimeters, and if you're trying to maintain weight, it's 1,500 to 2,000 calories. And to lose weight is 1,500 calories. And for women who are under 5 foot, 1,200 calories to lose weight. Okay, so this is just roughly the numbers. But my question to you is, how many meals or snacks in general do you have in Ramadan? 2, 2, 3, 2. Okay, that's actually good. The recommendation is to have at least 2 meals and 1 or 2 snacks. And especially this is more relevant for diabetics, but in general, this is a good thing to implement. So 2 meals would be definitely at suhoor and iftar, for example, and then 1 or 2 snacks in the middle. Now, some might think that that's a lot, but if you actually look at it, it's not that much. It's something that we're probably usually doing. So one example is, let's say we open our iftar with water and dates or something, or something like, chole, or, some type of snack that we eat. And then you pray, and then you go and have a proper dinner, like roti, rice, meat, something like that. And then after iftar, you're usually hungry, so you might go for a snack afterwards, and then at suhoor have a meal. Now, if you are someone who are, following what most people are doing right now, is probably open your fast with just water and dates, and then have a actual iftar, we can call it a snack, but generally, chole, pakore, dahi vade, everything, all of those is the actual iftar. So I'm still going to call it a snack, not a meal, but it should technically be a snack. And then you'll probably have, depending, after when you're going to sleep, maybe you have a dinner and then you'll have suhoor. Now, there are some people who skip suhoor. Like there are people who just wake up and drink water or milk or just have some dates. But because we are specifically talking about diabetes, that's not recommended at all. It's very, very important to have suhoor. Do not skip suhoor. And it's also sunnah to try to eat suhoor and to do it as late as possible. So that's also the medical science recommends the same thing. So I think that brings me to the question, do any of you skip suhoor? Good, alhamdulillah, good. And if there's anyone in your family who does, please try to encourage them not to. Okay, so very important is the calories. If you notice, this is the breakdown of how many calories you should have per meal. So at suhoor, most of it, 30 to 40% of the calories you're going to have in the day should be in suhoor. That's a lot of calories. And then the iftar snack, depending on what you're snacking on, should be about 10 to 20% of your calories. And the meal should be about 50%. And if you choose to have a second snack, which is advised depending on what's happening, you can have about 10 to 20% again of your calories there. So let's get some numbers in. Now, this is for someone who really wants to know their numbers. So I put this together. So if your goals are, so I'll stick to the 1500 number because this is roughly goes from both men and women, women who are trying to maintain their weight or lose weight, and then men who are also trying to lose weight. So roughly, these are the number of calories: 450 to 600 calories per suhoor, and all of that. You'll get. Are you getting notes? I'm not sure. Are you gonna send these? We'll put it together and we'll send it to you if you want. Okay. So now I just put this also. If you decide to have a proper iftar and you want to combine your two snacks and make it an iftar, this is the calories that you need for that. It's not too much if you compare it to suhoor and the meal. It's not much at all. Okay, so let's talk about, I talked about calories. So we talked about obviously distributing your calories, but we also want to talk about distributing your carbohydrates, protein, everything, because that's really, really important, especially in Ramadan and especially for diabetes. Carbohydrates is the most essential, and that's what I'm going to concentrate on today. So now, I don't know if you've ever heard of carbohydrate exchanges. Has anybody heard or was trained on carbohydrate counting or exchanges? Okay, so this is going to be new news for most of you. Now, the thing is, especially in diabetics, and this is more for if you are diabetic or anyone in your family who has diabetes, it's important to know that we categorize carbohydrates to make life simpler for you. We give it numbers and we say you can have this many exchanges of carbohydrates per meal. So, and I'll get to what it means in more detail, but generally one exchange means 15 grams of carbohydrate. Okay, and we'll talk about that, but I just want to give you some numbers just so you know. So roughly for suhoor, you can have about 3 to 5 exchanges. So let's talk about iftar first. So let's talk about iftar snack, 1 to 2 exchanges. So one exchange, I said, equals 15 grams. So this is khajur, dates. So we all love dates. We know about dates, and dates come in all shapes and sizes. It comes from all over the world and different places. So what I did is compared 3 different types of dates to see how much it has. So a regular, medium, or small size date, the deglet nu date or the ajwa dates, are roughly about 5 grams of carbohydrates. So if you probably can't see it, but it says 5 grams here, and ajwa date, it says 6.7 grams here. Now, generally, when we look at carbohydrates, we also carbohydrates contain sugar, it contains many other carbs, but it also contains fiber. Now, fiber is a carbohydrate, but it's not absorbed by our body. Our body cannot absorb it, but it has many good things that it does for us to improve bowel movements and improve digestion, reduce cholesterol. It has many, many advantages. It's very advantageous also in diabetes. So what we do is remove fiber from the total carbohydrate to get a net carbohydrate. It's a little advanced, but if you have diabetes, this is something we do train. But anyway, the point is that these two are roughly 5 grams or 6 grams of carbohydrate. One medjool day that we get, it's 18 grams. If we do the net, it's 16 grams. Okay, so that's equal to 1 exchange. So that technically means that 1 medjool date is equal to 3 of the small dates. Okay, and we know that we can eat in odd numbers. So if you're someone who likes to eat dates, I would say choose the smaller size date and have 3 of them. And that counts as 1 of your carbs. But if you eat medjool day, just stick to 1. If you do 3, you're over your budget, because you see, I said you can have 1 to 2. And if you ate 3 medjool dates, you're already like 3 and above. And that's a lot of carbohydrate at one time for one person. So does that make sense? Yeah? Okay. Now, so the best recommendation is to follow the sunnah and just start your iftar with water, because of course of the dehydration that we face at 16, 17 hours of fasting. So make sure we drink a lot of water, 1 to 2 glasses, and then choose 1 to 3 small, medium size dates. Again, depending on what else you're going to have at iftar, it can fluctuate. Then pray Maghrib. For a lot of us, we do all our, iftar as much as possible, and then we pray Maghrib. It's better to just drink water and start with dates. If you choose to have nuts like almond or something, that's okay. And then pray. And then after that, have a proper dinner, or if you want to do the iftar snack, that's okay. Just then give some gap so your body can digest and absorb a lot of that. Okay. Now we'll talk about the most common thing that we do in Ramadan is drink. And I know it's good because we want to stay hydrated, but what are mostly the types of drinks that we drink in Ramadan? Sorry? Ruafza. You said lassi, juices, faluda, for example. Yeah, but ruafza, I think, is very common, right? Now, the thing is that unfortunately, drinks are again going to be very sugary and very high in carbohydrates. And the problem with drinks is your body, we don't feel full after drinking them, right? It just goes inside our body, but the sugars are going to be doing the same thing that eating a rice is going to do, but we don't feel full. And we feel, oh, it's just a drink, right? But that's a lot of calories. So in most cases, especially for diabetics, it's just better to avoid it completely. If you have to have it, then do maybe half a cup, because we look forward to this, right? We look forward to Ravza. We wait for the whole year until Ramadan comes, and then we can do all these special drinks. If you have to have it, maybe occasionally, that's okay. Don't make it a regular habit. And if you do, try to add something to it. So lassi is a good option because you are diluting it with some protein, but it's still a lot of carbohydrates. The other thing you could do is add seeds, the chia seeds or flax seeds, or tukmalanga, balanga. That's very common that we do. It's actually basil seed. So what they do I think you already know, when you put it in water, it swells up. It's the fiber. And like I said, fiber negates, like it sort of helps and balance things up. So it's always good to add, something to the drink and stick to a small portion. And by portion, I'm talking about a very small portion. That's almost 1 exchange for a drink. So, or you could do nuts and seeds, or the other option you could do is add lemon to your drink. So you can add lemon to ruafza and make it a little bit less, lower in the glycemic index, and we'll talk about that. So generally, even natural fruit drinks are very similar. They're also not that great. You also want them to be in this portion, about half a cup. So the worst ones are obviously the ones that you want to try to avoid and not consume is regular soda. Most energy drinks and sport drinks, they are very high in sugars or caffeine, so make sure you avoid that. And most drinks that say fruit drinks or juice, they're not that healthy. The other ones that are okay to have occasionally would be if you want diet soda or low calorie or low sugar drinks, or 100% juice. So when you see on the box or it's freshly squeezed in front of you, of course that's an option. But on when you go shopping, you'll see, for example, Tropicana or I think Minute Maid, they have on the box, it says 100% juice. And that means that it has no added sugars or nothing else in it. So for that, that's better. But again, occasionally and stick to a small amount. And obviously the more you can have with water or sparkling water is fine, or you could do skim milk or 1% milk. Now, just a few things about fruits. It's better to obviously eat your calories and drink them. But if you have to drink, instead of doing juicing, which I think you lose a lot of the fiber when you juice a drink. So it's better to make a smoothie instead. So use the whole fruit, use the skin of the fruit, and you can have up to 3 servings of fruits in a day. It's okay. And yeah, you can add vegetables to your smoothies to enhance that. So that's a better juice, a smoothie instead of like a ruafza, for example. But ruafza, like I said, once or twice a week is okay on occasion, or in a dawat maybe or a party, that's fine, but don't make it a normal daily thing. Okay, so going back to the exchanges, just to give you some idea, I think Dr. Saima mentioned let's say when you have a low blood sugar, you need 15 grams of sugar or honey or something. So that is the same thing. So one exchange is about 1 tablespoon of honey or sugar. And so that means for people who are drinking, adding sugar to your teas and coffees, those are something to think about. Generally, 1 teaspoon is this. If you have measuring spoons at home, I would recommend you actually look at that. So 1 teaspoon is equal to 3 tablespoons. So if you are using like the regular teaspoon that we have at home that we cook with or eat with, it's usually somewhere in the middle of the two. So I want you to be careful. It's better to measure it out and see how much actually sugar you're using, because what if you're using less than 1 tablespoon, then you have a bigger budget of having more things. You can have more fruit instead of just the chai. And what if you are having a whole tablespoon? You think you're drinking a teaspoon, but you're actually doing a tablespoon. That means that you are already 1 exchange short. Then you have only 1 more to go, for example. So those are things I want you to look into when you go home and just figure out how much you're actually drinking. So roughly, other than a tablespoon, one single fruit, for example, 1 regular apple, 1 orange is 1 serving or 1 exchange. Half a cup of juice, or those fruits that you can't measure, those grapes or raspberries or pomegranate, how do you measure them, right? So that's half a cup. So I didn't bring it up, but half a cup, if you have a measuring cup, how much that is. Also, a 1/4 cup of dried fruit. I'm not talking about nuts. I'm talking about fruits that are dried, raisins, cranberry, dried fig, dried peach, those fruits, 1/4 cup or like a handful is 1 serving, because they're dried. They have the same sugar, but it's just squeezed into small size. So that's why you want to have 1/4 cup of that. And one thing to always remember, milk and yogurt also have carbohydrates in them. So 1 cup of milk is 1 exchange, and 1 cup of 3/4 cup of a yogurt. So to bring all of this in perspective, if you look at iftar, roughly, if you can have about half a cup to 1 cup of fruits, 1 dairy. So if you did half a cup, that's 1 exchange. If you did 1 cup of fruit salad, for example, that's 2. Okay. So let me go back actually. So I just want to show you, for example, if you not meal, let's just put these 2 together. So let's say you can have about 3 or 4. So here you got 2 there, 1 dairy. And depending on, what else you're having, you can have lentils like chole, for example, is an option. So fruit salad, maybe lassi, depending on how much sugar and fruits you have in it. Chole, and then maybe one fried item, depending on if you have fried items, and stick to one fried item instead of more than one. So if you're going to do pakora, just do pakora, don't do samosa and pakora. So that's sort of how you want to do it. So that will give you roughly how much you can have per iftar. So far, are we good? Do you have any questions? Okay. Next, I want to focus on the meal of iftar. So that means dinner, basically. So let's say we're having roti or rice or pita bread or something like that. So one slice of bread is one exchange again. Half a small bagel. Now bagels are huge nowadays, so those don't count. So small bagel, half of it, or naan, even naan, about half of a small naan. Because naans, when you actually go and look at their nutrition label, you'll see how much carbohydrates that's in there. So it's better to stay away from naan and parathas. Rotis are okay. Rotis would be about this big, 6-inch size of roti is one serving, or half a cup of rice or half a cup of pasta or cereals, those things. Now, the good news is you can have up to between 3 to 6 exchanges, depending on your calorie budget, roughly 3 to 6 exchanges. So I'll get to what that means, or what that will translate to in a minute, but there you go. So let's say you have rice, okay, for example, or any type of whole grain, maybe cereal for breakfast, for suhoor. So if you have 1 to 2, so one, I said half is one serving, right? So when it comes to 1 cup, that's 2 exchanges. So if you did all 2, that's 4. But you still have a budget of 2 more if you're doing up to 6. So 1 dairy is 1 more, 5. And then if you have dal, for example, dals also have carbohydrates. So that will be another 1, and that's 6. Good news is vegetables don't really have much carbohydrates in them. Most don't have it. There's some that do, and I'll talk about them, but roughly most vegetables are almost zero carbs. So you can eat as much as you want without breaking your bank or your budget. Okay, so this is the DARS Canada's plate, DARS Ramadan nutrition plate. So what it's saying is you can have about a cup of vegetables, about 1 to 1.5 cup of rice. This is being liberal because, they have a fruit here. So 1 to 1.5 cup of rice, or, 2 rotis or 2.5 rotis. Or when it comes to pita bread, it's half a pita bread is one exchange. So you could have up to 1 full or 1.5 pita bread. And then you can have lentils. It's recommended to have lentils because of the antioxidant properties in it. That's why it's recommended. And then proteins, for example, fish, eggs, chicken, beef, most of those would be here. Also, just keep an eye on the type of oils, especially if you have heart disease in your family or you have high cholesterol. It's very important to monitor amount of fat. So it's about 2 teaspoons per meal. Yeah. All right. So now so far I talked about the amounts. Now I want to talk about the types of carbohydrate, and I'll just be a little quick on that. But roughly, has anyone heard of the glycemic index before? Have you heard of the word glycemic index? Okay, so basically glycemic index is it's a scale that tells us after eating some foods, how our blood sugar will rise, okay? So for example, when you eat some foods that are known to be high glycemic index, it means it's gonna raise our blood sugar. So high means high blood sugars eventually. So some foods like chips, biscuits, cakes, ice creams, dates, all of these, what happens is when we eat them, within an hour, our blood sugars are gonna rise. Within an hour, especially this is most important at suhoor. Is very important to avoid foods that are going to raise blood sugar levels, because what's going to happen? Blood sugar will drop, and what you can't do anything afterward. When they drop within usually 1 hour after suhoor, you will start feeling hungry again, thirsty again, and that's definitely not good for the blessings of Ramadan. But also if you have problems like high blood sugar and that the blood sugar goes low, it's too late to do anything about it because you're already fasting, right? So it's very important to avoid these foods. Instead, have foods that are low glycemic index. That means that they do not raise blood sugars high. They'll raise it in a small amount and they stay stable for many hours. And you don't feel hungry for many hours. And you don't feel that your blood sugars don't fluctuate too much. And that's very important in Ramadan. So I'll get to the details of these foods in the next slide here. So we'll start with fruits because those are the most easy ones to understand. So the low are the ones we want to have. The medium are the ones you want to have sometimes, but not all the time. And then the high are the ones you want to avoid as much as possible, especially at suhoor, but overall as well. So let's look at the low glycemic ones. So most of them are the ones that are temperate fruits, or fruits that have substance, that are full, heavy. For example, apple, especially if you eat it with the skin, it's even better. Apricot, green banana, berries, most of the berries are great. Cantaloupe, grapefruit, mango, even depending on the ripeness, orange, peach. So all of these, pomegranate as well. So all of these are good fruits to have. So if you are going to have a fruit at sahur, it's better to choose these, even at iftar, of course, but especially at suhoor. Now, the ones in the middle that you want to have sometimes are those things like grapes, kiwi, figs, pineapple. Can you imagine? They're already sort of not that heavy. They're very light. They're more watery. Grapes, if you notice. So that's why you want to stay a little bit away from them, because they can raise blood sugar levels. Now, obviously, the watermelon and overripe banana is one that you want to reduce as much as possible because they can raise your blood sugars immediately, and we want to avoid that. So just a quick, I love this image, so I show it a lot, but this is not only for bananas, but for most fruits. The less ripe it is, the more fiber and the less sugar it has. And as it ages, as it ripens, around the stage, it's still okay to have. But the more it ripens, the lower vitamins, the lower fiber, and the most sugar it has. So even with, for example, overripe peaches, the same thing. Overripe banana, mangoes, same thing. So if you want, have an underripe or just ripe, but don't go for overripe or extreme ripe ones. Okay. Now we come to vegetables. I said there are only some vegetables that have carbohydrates in them, and those are potatoes and corn. And so if you see here, this is the low glycemic, the one that you want to have. This is the one you want to watch out for. This is the one you want to avoid. So let's look here. So baked potatoes are not good. French fries again, rice cakes. So these are ones you want to try to avoid. Those you can have on occasion would be white potatoes. So not baked, but either boiled or either steamed or something. Yeah. Sweet corn, you can have popcorn, that's okay on occasion, but the best ones would be sweet potato. And funny thing is, sweet potato is not even from the family of potato. It's more, I think, related to ginger than it is related to potatoes. So it's different. And yams, and then lentils, like all kinds of dals, chickpeas, kidney beans, all of these. So these are better, and these are ones if you wanted to have it at suhoor. Instead of potatoes, have sweet potato, for example. Okay. Now we come to breads. So I think we all know this, but white breads are ones you want to watch out for. Bagels, dinner rolls, those ones you want to try to avoid. The ones that you can have, and some people are kind of surprised to see whole wheat in the middle, but actually whole wheat is good, but it's not the best. And I'll show you some, but it's still really good. Rye and pita breads are in the middle category here. And then when it comes to the best ones are those that are stone ground. So they're mostly not very fine. So you'll see chunks of oats or flax or stuff in it. So that's the better one. Or mixed grains, where you have multiple grains and you can see some chunks and pieces in there. Whole wheat is still good. It's just that you want to find. So yeah, you want to find whole wheat, which is, either stone ground, but with multiple grains, and it has more things. And pumpernickel, for example, is another. Now, cereals, mostly what I want to talk about is steel cut oats. These are the best ones. Regular oatmeal and quick oats, these are good, but not as good as steel cut, because steel cut is um, firmer. This is more pre-digest, like sort of already sort of cooked. So yeah, yeah, they're all high. Yeah, exactly. They're high in fiber, exactly. And if you see what I'm saying so far, you can understand the whole point is slowing digestion, slowing the breakdown of these foods. So slowing release of sugars. That's the main idea behind all of this. And of course, adding more fiber, like I said, adding chia seed or psyllium, or those things always enhance that, because it is slow digestion. Okay, so some examples of atta. Most people, say I use whole wheat atta. That's good, but there are also multigrain attas out there. They have things like soy and oats added to them, so you can always go there. um, Also, there's some breads. I like this brand, but of course, there are many brands out there which have multiple grains added to them, and they're usually stone ground as well. So that's an option. Now, this one is emotional for a lot of us, rice and pasta. So we all know that they have carbs in them, but I'm going to surprise you a little bit here, but I'll say, first of all, short grain rice or jasmine rice are high glycemic, so you want to avoid them. Basmati rice and brown rice, they're kind of in the same category, surprising. But they are good for you. But like I said, occasionally better than brown rice is parboiled rice. Okay. And funny thing to see here, you'll see pasta here, and I'll explain why. And then bulgur, barley, those ones. And most ancient grains are pretty good. So parboiled rice is actually a rice and you can find it in basmati rice. You can find it in most of the brands that we buy. They are also nowadays selling the parboiled, or you can also get the Uncle Ben's parboiled rice. Basically, it's just pre steamed and pre-boiled, and then they freeze it again, and then they have a better glycemic index. So they lower the glycemic index. A few other things I want to show, because pasta was on the list. The reason why it is because if you undercook your rice and your pasta and even your potatoes, they're nice and firm. Al dente is the word that we see on the Italian boxes, right? That's when it has lower glycemic index. So you can actually make your rice better by undercooking it instead of overcooking the rice. And I think we all like standing rice anyway. So yeah, undercook your rice. Make sure you drain the water off, so you throw off the excess starch. But another thing you can do to make rice better and healthier is add some acid to it, vinegar or lemon. Adding a little bit, a few drops, or teaspoon of lemon or vinegar to the water when it's boiling actually makes the rice healthier. It has lower glycemic index, so you can do that and then drain off the water. The flavor will not stay there unless you're adding like 1 tablespoon of vinegar. Then maybe you'll feel it, but in most cases you don't feel the vinegar or the lemon flavor if you add like a teaspoon, and it'll help. Same thing you can do with potatoes and with pasta. One really thing that I really like to tell, how I think most of you have had biryani before. A lot of people like next day biryani better, right? It sometimes tastes better. And one of the reasons why is actually rice gets better when it's cooled down and reheated. So it's better to eat day-old rice than eating freshly boiled rice. So one suggestion I usually give my patients is make a big batch of rice, parboiled if you want, and then like over the weekend, for example, and just take small amounts and reheat it. So put it in the fridge and then reheat it when you want it. That's again lower glycemic index for that. And last thing is same point, because it's when you make stir fry is a lot better than just steamed rice, and even pulao is actually better. But the best is stir frying because of the fact that it's old rice, and then you're recooking it with a little bit of oil and protein and vegetables. So stir fried is always best. So I usually say keep at least one day to use all your leftovers and make fried rice out of it, because it's actually healthier. So you can eat rice small amounts. We talked about the amounts, but rough, if you want to make it better, do these steps if you like. Okay. So I think that sort of concludes what I have to say. So just reminding you of the plate that we want to stay at as much as possible. And one thing that I want to also say is meal plans are created by DAR Alliance. So if you are interested in getting a meal plan for yourself, you can go on this website, daralliance.me, and you can just follow some steps. I'll just walk you through what to do. So you'll go on this site, you'll just click on this Ramadan nutrition meal plan. And what it'll take you to a map, and you'll choose the country of choice. Now, not all countries are there, but you can choose the closest one to you, and it'll give you options. So you'll just go ahead and click, and you'll go on the patient area. Okay. And then it'll ask you some questions. So you start your plan. It'll ask you to choose your target weight and some other questions. So I'll show you. So I'll ask you, I would like to lose my weight, or I would like to maintain my weight. And you can choose, let's say you want to lose weight. And then it'll ask you if you're male or female, and you can just choose that. And it'll ask your height. And based on that, it'll tell you, okay, this is how many calories you need. And then you can choose your cuisine of choice. So we have right now Egyptian, Indian, Malaysian, and a few others. So you can choose the one. So I'm just showing you an Indian meal plan. This is what you get. You get a 1 week's meal plan, and you can just click on one of them, and it'll show you what you can have. So this one here is an iftar meal. It's showing you can have a glass of water, 1 piece of date, parboiled rice, 1.5 cup, steamed fish with green chutney, bottle gourd, sabzi, and cucumber raita, for example. Another option would be pulka, so 1 roti, right? And the grams are usually written, but it's not written here. Anyway, dal, some bean sabzi, for example, this one, and tandoori chicken. And if you see, it tells you the exchanges, and it'll tell you how many calories this is of your overall day's need. So it's a pretty good one. So you can go and download these, and then, yeah, that's pretty much everything we wanted to share. Thank you for your time. And if you have any questions, please go ahead and ask. Any questions? Yep.
Okay. The question is about right. So, if instead of water, can we drink coconut water without any sugar? It's good.
Yeah. Yes. So the question is that instead of water, can we drink coconut water at iftar? And our answer is yes, you can if you want. The only thing is it does have some sugar in it, maybe not as much as a full 15 grams, but it does have some sugar. So just keep that in mind. But yes, there's no problem in drinking coconut water. Yeah. Any other questions? Yes, it's basically the same rice. It's just they process it before they sell it. So what they do is they pre-boil it, and then they freeze dry it again. And then it's the same thing. The texture will be a little different, and it'll be a little thicker than the rice that we're used to, but it's still, it's almost the same. And you can get it in basmati, you can get it in long grain, you can get it in short grain. So all rice brands can be made parboiled. No, Sailor rice is a brand. It's like a species of this. So even Sailor rice, the one I showed you, even Sailor rice can be made into parboiled rice. But the texture is very similar to Arabian rice. You know, if you've eaten Afghani or Arabian rice, it's a little thicker. That's the texture that usually will be. And it does take a little longer to cook. Yes. Yeah. Yeah, so the question is, have I seen biryani made with parboiled rice? I've made it myself, yes. And you do get parboiled rice in the same bags that you get basmati rice. So it might be a little expensive and might not be as easily accessible, but yes, you can definitely find it and buy it and prepare it for sure. So definitely you can add teas and coffees at any time. Usually, okay, sorry, I should repeat the question. The question is when to add tea and coffee. So you can add it at usually any time, preferably like after you had your meal, if you want. Again, the point of it is how much sugar is in it is the most important question, right? So if it's small amount and it goes within your budget, perfect. If you're using sugar replacements, for example, sugar substitutes or no sugar, then at any point you can drink it. Best is to avoid it at suhoor because of the dehydration it can cause. So it's better to do it, between iftar and maybe even tarawih time is okay, but don't do it 2 hours before bed because then it'll disturb your sleep also. Okay. Yes. Yeah, so the question is what to do about sweets. Now, sweets, it's the point with sweets is you want to limit it to small amounts. I won't say stop having sweets because you can have sweets, of course, but in very small quantities. If it's and again, I usually say if you have a label, look at the label and just get an idea. But definitely don't do it at suhoor. If you want, do it at iftar. You can replace your fruit salad or your dates, for example, with it. But you have to compromise one thing for the other. If you want to have a sweet, then you have to compromise something else. That's the idea. Yes, generally, yes. Yeah, if you have the label, read it and to get an idea because they're usually quite accurate. But yeah, you can have one. Like I said, most sweets I usually say try to do it occasionally. Don't do it like a daily thing. There are some people who do sweets every day. That would not be recommended. But 3 or 4 times maximum a week would be okay. The size and the syrup, of course. Yeah. Sure.
I have some online questions. So the first question is, could the health provider please comment on fasting for pregnant women? So we know that as per the hadith, the pregnant and the breastfeeding woman has been exempted from fasting. If they feel that they can fast, they can. If they find that it's hard, they're exempted. But especially if someone is pregnant and diabetes, then they come in the yellow zone. But if they are pregnant, diabetes, and on insulin, then we say that they should not be fasting. But if it's a normal pregnancy and everything is going well, it's up to the person if they want to fast or not. The second question is, I am using Synjardy, 5 milligram by 1,000 milligram. Is this safe? So Synjardy is a combination of Jardiance and metformin. So partial, we know that metformin is safe to go. Jardiance, I told you there's a little caveat to that. According to your kidney function, your age, and if you're using a water pill. So for this, you need to talk to your doctor about it. So metformin is good, but the other combination, we need more information, so I cannot tell you. The third question is putting flash glucometer monitor for 2 weeks on is okay while doing ghusl haid or janaba? Very good question. It might affect because there's a vacuum that is being made. So maybe that part may not get the water in. I think for that, you probably need to consult more because this is, again, become the necessity for a person. So sometimes there's an exemption for it. I might not be able to answer that. For that, you probably need to ask more scholars about that. The other question is, if a person is pre-diabetes and suffer from ongoing constipation due to less water intake in Ramadan, what they should do. You know, it's not even for diabetes, it's for most of us, because we are not eating well, we are not hydrating well, we get into that, habit of constipation. The main thing for constipation, as I did show, so there's two things that we want to make sure. It's not how many times we are coming. It can be minimum 2 times a week. The whole issue is how much time it takes to come out. The consistency matters, because if you put a force and it's really hard to come, then you may end up with hemorrhoids and bleeding. So general recommendation is that the contact time from commode to bump time should be 15 seconds. You understand what I'm saying? So you should not be staying on the commode for more than 15 seconds. That means you're putting a lot of pressure to it. For that, you need to work on it. So as we said that the fibers, start with 2 tablespoons. Anytime you make any changes to fibers is not going to happen next day. Fiber takes 3 to 4 days to work. This is the main thing. So you start with 2 tablespoons of fiber, and the third day your bowel movement is not good enough. You add in a fiber, make sure you're chasing it with water, then do 3 times a day. If you're using 3 tablespoons of fibers at least 2 times a day and you're not having it, that means fiber is not working. You need to go on other medicated laxatives. So I hope I have answered the question. But yes, this is something that if you're already experiencing it and you think Ramadan will make it worse, then you need to be on top of the things. Now, another misconception is that if I'm using fiber, my body will get used to it, right? No, I don't want to use it because my body get used to it. So the first thing I tell this thought of my body getting used to it, it is a myth, because it is not an alcohol, it is not an opioid, it is not a sleeping pill. So how come your body will get used to it, right? So this is a misconception. Second thing is that we know generally in diabetes, because of the involvement of the nerves, there is a slow bowel movement. Bowel movement gets just slowed down. The peristalsis movement that brings the food down is generally slow in diabetes. That's why they end up in constipation. That's why they have a lot of bloating. They feel that food is just stuck in the stomach. It doesn't goes down. So if you have that, then that means you need not only the fiber, you need another kind of agent, which we call a prokinetic agent, that we need to kickstart your intestine. So if this is something that you're suffering from, you need to talk to your doctor about it. Then maybe some other medication needs to be used. Yes. So I have a comment that in constipation, kiwi and prune works. Yes, because it's fiber. So in the end, whatever works for you, but you need to be diligent about it. I mean, you just cannot sit and, usually what happens is that just one hard bowel movement will rip you off. Just one will cause so much of hemorrhoid and so much of pain that the whole 2 weeks will be off. So it's better to prevent it rather than experience and that get the lesson. So in Ramadan, it's very important, especially with people with diabetes, they have a slow bowel movement. And if you don't work on it, it's going to be tough. Yes, sister. Good question. So I have a question here that what are the symptoms of pre-diabetes, how we can monitor it. So unfortunately, system, most of us, we would not know that we have pre-diabetes. That's why the normal screening becomes very important, especially if you have a family history. Your mom and dad and your brother and sisters have it. Second time, if you have a pregnancy with diabetes, that put you off. Right. So as a part of a regular annual checkup, one should be doing hemoglobin A1c, because hemoglobin A1c will put you in a spectrum where you are. Are you in a green zone? Are you in a yellow zone? Or are you in a red zone? Right. And after that, once you're pre-diabetes, you need to do some lifestyle changes, because if you don't change it, we have seen it, what happens in 5 years, right? So as such, there's no symptoms. Now, the another common misconception is that, when you say someone you're borderline diabetes and say, I want to check my blood glucose level, and they check it, and the number they have mind for fasting is 7. 7 is a diabetic number. And say, oh, my blood sugar is all good because it's 7. No, you're not diabetic, so your number will never be above 7. Your criteria for fasting will be different. So your fasting of a pre-diabetes would not be 7, it would be 5.6 or less. So another take-home number that if you want to know, everyone's, but we tell them that, 3 stars, if your fasting remains less than 5.6, you're good. So 5.6 and less than 7 is you're borderline diabetes at some point in time. Did I answer your question? So, yeah. Yeah. Okay. Okay, so I'll tell you where we got this fatwa from. It was from a Islam Q&A question. So in fact, in 1997, there was a conference that was held in Saudi Arabia where they have asked the experts, the fuqaha and the medical scholar, and they come up with specially certain procedures, certain medications, certain examination that should be done or not. I can tell you the reference. So the conclusion of that is the first thing it's a whole article where they actually say that what are the things that causes invalidation of the fast, right? So the first thing that we already know, that anything that goes past the throat goes into the stomach, that causes invalidation. The second thing, if it's a nutrition nature. The third thing is the intention. If you're doing intentionally, then. So let's see the sublingual, or we call it ODT, oral disintegrating tablets, like nausea medication, Gravol comes in, you put it in the top of the tongue. So first of all, the nature is it's not for nutrition. It's not a B12 tablet, right? B12 is for nutrition. So first of all, it's not nutritious. Second thing, it bypasses the stomach. So when you put it, there are a lot of blood vessels under the tongue, over the tongue, it bypasses the stomach. The third thing is your intention. Again, what's your intention for? So especially, let's say we talked about heart disease. So nitro spray. Why a person is using a nitro spray? Because the doctor told you whenever you have a heart attack, you need to use nitro spray so your vessels get opened and you don't end up in a heart attack. That's the reason, right? So most of the fuqaha, they consider using the nitro tablet or nitro spray does not break the fast because you're using it under the tongue. It is bypassing the stomach, right? Other thing, as you said, like lorazepam tablet for mental health disorders. Again, anything you use buccally, lingually or buccally, it bypasses the stomach. Again, it is not nutritious, right? So in that context, but again, there is a lot of like, especially with the fuqaha, there's always a difference of opinions. So we are following the ones that has consulted the medical community, the 10th Arab conference, can show you the reference. So according to them, the ones that are used for medical reasoning, bypassing the stomach and not nutrition in nature, then according to the fuqaha, that does not. Did I answer your question? So let's talk about B12 tablets or B12 injections. So B12 is for nutrition, even though it does not give you nutrition right away, but the purpose is nutrition. So that would, of course, invalidate the fast, right? Shaistha? Which one? Thai rice. Shaistha, Thai rice.
From what okay, so Thai rice, from what I know, I think it's I don't believe it's long grain rice. It depends. If it's a long grain rice, then sure, it's good. It comes in the medium glycemic index category. Jasmine rice, I know for sure it's not. It's not the safest rice to use for diabetics. So it's Thai rice. It depends on, from like I said, what I know, it depends on the length of the rice also.
So what I plan to do is I will send a PDF copy of a page or two about the important information to you, and you can pass it whoever wants it. The other good website to see, I can send you the PDFs. There's a lot of like free PDF available at Diabetes Canada, how to manage low blood sugars, high blood sugar, glycemic index, which Shaistha has shown, as well as a carbohydrate exchange. So I can compile an email and send it to you, and whoever wants it, you can forward it. Yes, please.
I'm just wondering, when somebody's fasting and they're diabetic, and throughout the day, the sugar is really good, but the last hour or two, it's up. What causes that while somebody's fasting?
So one of the sister asked, is that a person with diabetes, when they fast for a few 12, 13 hours, the sugar remains normal. And then when it's very closer to the iftar time, the sugar rises. So this is a normal compensatory mechanism that's usually happens. So what happens is that, so usually if you talk about a normal person, 12 hours of fast, nothing happens to the body. Body can easily compensate low blood, and nothing to eat and drink. Bodies. What happens is that when the time starts to get longer and longer, because there's no glucose, the other parts of the body like liver and muscle, they start secreting the glucose because you're not taking external glucose. So the liver kicks in and liver start degrading its glycogen into glucose and pushes into the blood. The muscle has stored glucose, it starts pushing it into glucose. So the body is compensating glucose, and that's why it responds to that, your blood sugars get more high. And that's why we tell to the diabetes, start eating, because you really don't want to give the sense to the body that you have low glucose. Otherwise your own body will try to compensate, and the body doesn't know when to stop it, right? So this balance, normal people won't have the disbalance. Of normal people, the brain will say, hey, stop, enough blood sugar, compensate. But in diabetes, there is a disconnect. So the liver is producing, the muscle is producing, brain doesn't tell them to shut down. And that's why you find closer to the high blood glucose, because body is trying to compensate. Did I answer your question? Yeah.
Someone's asking how to use psyllium fiber and
Okay. So I think me and Shaistha can both answer. The question is how to use the psyllium fiber and what is the right method, what time. So psyllium is an English version, and in our Desi version is we call it sparol husk. So so one of the great thing about psyllium is it's now medicated. So Metamucil again is a psyllium and it has a DIN number. So a lot of research has been done on psyllium. Best time to take fiber, psyllium, is kind of an evening time. We call it the tea time, not in the dinner time, not at the lunch time, kind of a snack time, because when you take it, it does interfere with your appetite, right? So the best way is kind of a later evening time, 5 and 6 o'clock. And the main thing about fiber is that you dissolve them in cold liquids, not in hot, because they really get, fluffy. So cold, milk, water, juice, whatever, the amount of milk so that you can drink it. Because if you have a big glass and you dissolve it, that you cannot swallow it. So usually we say ideally half to 2/3 glass, you dissolve it, you drink it. But that's the main thing. Once you drink it, it has to be followed by water, because it has to be flushed. So that's why the terminology of chug and chase comes. You chug it, then you chase it with additional 2 or 3 glasses of water. And research proven, psyllium fibers is good to lower craving, maintain appetite, decrease satiety, increase satiety, good for constipation, heart diseases, lowering of cholesterol, sugars, and things like that. Shaistha, you want to add something?
No, I think you said everything. Yeah.
So Flash monitor in Canada only comes with a brand name called Libre, Libre. It's a prescription monitor that your physician has to prescribe it. The continuous monitor right now it's coming up by the name of Dexcom, and it's only the website. You have to order it from the website. So Dexcom, Dexcom 4. I don't know it's com or .ca. Google it out, but you can buy it from their website. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for your time.